they just see dollar signs. They'll do whatever they can, to turn a profit, to make money for themselves and their investors. And it is, really disheartening that, they don't see people, individuals, right? We're not commodities. This isn't Walmart where we have products on shelves. These are people's lives. These are people's children, family members, mothers, fathers, sisters, brothers. And it is awful that they will come in and, treat it as such, treat it as just a business and just a budget and just money. That's not the way we should be running healthcare in this country. We are not cash cows. We are not there for, you to come in and invest and make a profit. I'm Maria Plano. I'm a nurse. I worked at St. Christopher's Hospital for Children. I was a nurse working there, and I was vice president of our union at St. Chris when Paladin, or AAHS, came in. It was a hedge fund group from California. They purchased St. Chris and Hahnemann. Initially when they came in, they were full of promises and, we're going to work with you because, we had a lot of issues at that time with staffing and with building repairs and supplies. And, we were trying to, work with administration to fix that, through our union. We were making some progress on it, and they came in. Joel Friedman came in and schmoozed us and told us that everything was going to be great and they were going to work with us and they were going to really, help us to help our community, because that's what we cared about was, the kids and the poor families that we served in North Philadelphia and around Philadelphia. We unfortunately came to realize that, the promises that they were making and the partnership that they wanted to build was, a myth. That was not their intention at all. And what they did very quickly when they came in, they did the same to St. Chris as they did to Hahnemann, is they separated the real estate from the entity or the business of St. Christopher's Hospital for Children. That resulted in, certain hospitals struggle, right? Or our hospitals in our area sometimes struggle, especially when you serve poor families and, they don't have the best healthcare. They don't have the best reimbursement rates. So St. Chris, just like Hahnemann, was profitable, but maybe just enough to keep the business running, to keep the hospital running and to serve the population. And when they separate, the real estate from the business and they start charging St. Christopher's rent, or, now not only does St. Christopher's have to contend with the budget that it already had, and, the small profit margin that maybe it was operating with, and now it was rent to some real estate company that Paladin was able to create. And this pushed the hospitals in our area, in further peril. As a result, Hahnemann closed. St. Chris still struggles today with, the cascade of that effect, or, the results of that. The business that came in, or the hedge fund group that came in and made all these changes in order to, suck all the profits out of St. Chris, run us bare bones and everything. What they ended up doing was driving out a lot of our specialists. They weren't renewing contracts with specialists. We watched a lot of our great doctors, not just great doctors, but other healthcare workers, respiratory therapists, physical therapists, nurses, doctors. We watched them all leave the hospital. And that just eroded, away at, the care that we were able to deliver, the services that we had available, because now we have less specialists. We have, yeah, our appointment times were longer and longer waits. Families who worked with these specialists for years and brought their kids to St. Chris whenever they were having medical issues, left with them and went elsewhere. And St. Chris is still suffering from that today. It takes a lot of work to bring specialists back, to build up our outpatient realm so that our inpatient then, grows with that. So it's really detrimental to St. Chris. It was detrimental to Hahnemann, and that ultimately was the nail in the coffin for them, and that's why they closed. We need legislation. We need our government to step in and do something, because, when you just let these hedge fund groups run roughshod and do whatever they want, they're not thinking about our patients or, healthcare in general, or somebody's life, life is at stake. They're just thinking about the bottom line in their budgets. So we need to force them, to do the right thing by our city and by our patients. We need legislation and regulations in place to force them to do the right thing, because we all know, whether you're, the owner of that business, whether you're a healthcare professional, whether you're a legislator, we know that corporations are not going to do the right thing. That is the trend in America. So we need to do something to force them to do the right thing.